Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. We're going to be speaking with Mr. Michael Clark in this segment. Michael is CEO of DeliverHealth. DeliverHealth is a global provider of technology-enabled solutions for hospitals, health systems, and group practices. He's joining us to discuss the company's recent acquisition of PresidioHealth. It's a healthcare technology and clinical intelligence company, as well as the launch of the DeliverHealth platform. Welcome to Health Professional Radio, Michael Clark.
Thank you, Neil.
A bit of your professional background, if you would. Of course, you are CEO of DeliverHealth. Are you an entrepreneur? Were you engaged in healthcare all your life? Is this something that you've been involved in for quite some time?
Yeah, I've been in healthcare for just about 30 years and have sort of had an interesting path. Started out early on in early stage startups, and we built those and acquired and built our way to ultimately selling off to a private equity firm. And then I actually went the public company route and was the COO of a large mid-level healthcare services company. And then actually went back and did another small little venture. And ultimately landed at Nuance about 5-6 years ago and was the GM of the healthcare provider solutions line of business inside of Nuance. And most recently, we spun out a couple of their Nuance businesses, and I took the role as the CEO of the spin out, and that's how we are at DeliverHealth.
What is DeliverHealth's backstory? How did it come about, and what is the actual mission?
Sure. So our mission is really to simplify the complexities in healthcare. One of the things that I've learned in healthcare over the years is hospitals and health systems are really good at taking care of patients, and their next best dollar of investment is always going to go toward patient care. So as a result, they really struggle with some of the investment on the business of healthcare. So they look for at scale, strong, trusted partners like a DeliverHealth to bring them technology enabled services to help them actually run the business. And we spun out from Nuance our EHR services, which is we have incredible domain expertise around how technology works inside of an EHR. The EHR is without a doubt the second largest investment a health system will ever make. First, of course, is always going to be the clinicians and the physicians. And so we help them simplify those complexities that EHRs bring and actually help them become more efficient in the work that they do, both from a patient engagement as well as a physician engagement.
How has the COVID-19 pandemic been significant in the birth of DeliverHealth? And how has the pandemic impacted your customer base and your core challenges?
Sure. So if you think about, we spun out right smack in the middle of the pandemic. And by that time, though, hospitals and health systems, they'd really sort of figured out how to manage these waves of COVID. But what they needed and what has really affected them, which again plays to our strength in supporting them, is that, what you hear about as the Great Resignation. I mean, hospitals and health systems, they no longer really let anyone inside the four walls of a hospital unless you're sick. And so even their staff and their supporting staff are mostly remote now, they've literally burned out because of the pandemic. So, if you go and look at any hospital or health system's website and you look at the amount of staff they're looking to hire and bring back, it's just overwhelming. And so companies like ours that can come in and help them both from think of it as staff augmentation and or literally just outsourcing, what we refer to as a managed service, just taking responsibility for that function from them and acting as an extension of them. So it's really, the pandemic itself has really driven health systems has sort of changed the way they operate and how they partner differently with tech-enabled services firms.
Now, when we're talking about technology, that covers quite a lot of ground. I understand that you recently acquired PresidioHealth. Talk about that acquisition, if you would, briefly, and the launch of DeliverHealth's platform. What type of technology are you offering to your clients?
Right. So when we spun out from Nuance, we spun out with the client base. We say we have 800 plus clients, but as an example, a Tenet health system is one client, but they have 100 hospitals. So we're actually in 2,200 or more facilities across the U.S., Canada, and Australia with our platform. And our platform is around documentation and how do we put greater value into that workflow. So that's where something like a Presidio comes in, because we can plug in the coding into that workflow. So now through that same platform, a health system can get greater capability. And really the value of the technology is to continuously improve the efficiency and the effectiveness of the workforce through automation, machine learning, and AI, and we're able to plug those capabilities in and move across the revenue cycle or into the contact center and support center area.
Is this going to enhance DeliverHealth's capabilities greatly?
Yeah, so we have a very strong baseline, but when we think about our growth and expansion and bringing technology and capabilities to the table, we always look at it: should we build it? Should we partner with somebody, or should we acquire? And in this case, we looked at the asset and the value, and we decided to acquire that capability. Now, why do we build, partner, or acquire? We really look for three things. Can we help drive costs out? Can we help the health system garner the appropriate reimbursement? And third, are we helping them improve the care of patients? If we can do all three of those things, then we've got a winner. And certainly we saw that with the technology that Presidio brought to the table.
How seamless is it to implement your platform with existing systems in a facility?
It's very seamless, and it's what we do is we create either integrations or APIs with these third parties and bring that into the workflow. So it actually is greater speed to value for the hospitals and health systems. They don't have to they don't have to acquire yet one more point solution. B, they don't have to create new interfaces or new integrations. It's already present, and we do that heavy lifting for them.
Are there any announcements, any upcoming events that we should look forward to from DeliverHealth in the coming months? Sure. Actually, one of the things in spinning out, we stood up our headquarters in the Tampa area, Clearwater, Florida, and part of that headquarters, we have built out a very modern customer experience center that will be opening up here. And again, as things have changed in healthcare, how they engage, how they procure, we see it where a lot of healthcare executives actually go out and go to their partners. And so, we've set up an experience center to bring clients and prospects and partners into the experience center and let them live the platform, let them see how the technology works inside and how the human in the loop working on the technology actually does it more efficient, more effective, and they get to experience that in a real world situation. Michael, give us a website where we can learn much more about DeliverHealth. Sure, www.deliverhealth.com, DeliverHealth.com. Appreciate it. Thank you so much for your time. It's been a pleasure speaking with you. Hopefully we'll have an opportunity to speak again. You got it. Thanks, Neil. You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Michael Clark, CEO of DeliverHealth. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download it, SoundCloud, and be sure and subscribe to our YouTube channel. at youtube.com/Health Professional Radio.